EXPRESSGETTYScotland Budget Cash available for NHS property has been slashed by more than £70 million. Finance Secretary Derek Mackay visited the Queen Elizabeth University Hospital in Glasgow yesterday to highlight an overall increase in Scottish health funding in his £201,819 spending plans. However, hidden in the small print of Thursday's budget was the fact that NHS capital expenditure was cut from £408 million last year to £336 million this year, a real terms drop of almost 18%. The £201,617 capital expenditure limit was £537 million, meaning that £330 million has been cut from the Health Services Buildings budget in the space of just 2 years. This would have been enough to pay for the new £270 million Dumfries and Galloway Royal Infirmary, with the remainder helping tackle the repairs logjam. Getty Finance Secretary Derek Mackay visiting the Queen Elizabeth University Hospital in Glasgow. It's a reckless move, and one that will mean that many health facilities will start falling into an even worse state of repair. Miles Briggs MSP Tory Shadow Health Secretary in July. The annual NHS property survey put the maintenance backlog at £887 million, with 4% of the estate unsatisfactory and requiring major investment or replacement. A further 26% is in need of investment to improve its condition. Tory Shadow Health Secretary Miles Briggs MSP said the backlog of repairs has been widely publicised, and we need to take urgent action to fix the problems that are emerging. Getty Stock in July. The annual NHS property survey put the maintenance backlog at £887 million, yet despite this the SNP have chosen to slash over £70 million from the NHS capital budget. It's a reckless move, and one that will mean that many health facilities will start falling into an even worse state of repair. Despite the cut, the NHS resource budget, to pay for wages, medicines and other running costs, has increased by more than £200 million to take the overall total to £13.4 billion in real terms. Mr. Mackay said this will ensure continued investment in facilities and services, funding a new GP contract and increased investment in mental health, while also supporting reforms such as major trauma centres.